It's the Joe Pag Show. Really glad to have you here. Really glad to have back on the program my friend, my senator. He's the Republican from the great state of Texas, Ted Cruz. Ted, how are you?
Thanks, my friend. I'm doing great. How are you doing?
I'm living the dream. You know, we were all very concerned about you. Obviously, you felt as though you might have had contact with somebody who was infected or had contact with the coronavirus at CPAC, and you did a self-quarantine. First and foremost, what'd you find out? Are you okay?
I am healthy and strong. Thank you for asking. I have no symptoms. I am coming up to the end of the self-quarantine. My self-quarantine ends tomorrow. As you noted, 2 weeks ago, I did encounter two different individuals who subsequently tested positive for coronavirus, and so That's why I went into self-quarantine out of an abundance of caution. But the good news is that I am healthy and strong, and the quarantine ends tomorrow.
Ted, what is the process? Because I really don't know. I had a back and forth with somebody, I think Friday or Saturday on my show, and my comment was, if you don't have any symptoms, if you're not feeling bad, then you probably shouldn't freak out and self-quarantine, unless, of course, you know you had contact with somebody like you did. But frankly, there is a gestation period where you might not know that you have it or that you're a carrier of it. But how long is that? Is it a full 2 weeks that you need to stay away? And people are freaking out who didn't have contact like you know you did, and should they be?
Right. So in terms of self-quarantine, if you have encountered someone, if you had close physical contact with someone who you know is tested positive for coronavirus, then a self-quarantine makes a lot of sense. And typically the incubation period is 14 days. That's the period I followed. Now, when I initially found out that I had shaken hands with an individual who had tested positive for coronavirus, I spoke with the CDC, I spoke with HHS, I spoke with both the Harris County and the City of Houston health departments, and all of the doctors there advised me that I actually did not meet the CDC's criteria for self-quarantine because my interaction with them was very brief. It was just a short handshake, and it was at that point 9 days later, and I was asymptomatic. I wasn't feeling sick, and so they said that was not within the criteria, but I decided to do it anyway. I just decided out of an abundance of caution. You know, the job of being Texas's senator is you're representing 28 million people. And as you know, in normal circumstances, you're out, you're visiting, you're meeting with hundreds of people every week, if not thousands of people every week. And so I didn't think it was fair or right to potentially risk anyone else's health and safety. So I've spent the last 9 days now just sitting at home in my living room and my bedroom and working from home. And actually, I should note, in terms of what people should do, the CDC has given quite a bit of guidance now. If you're a senior, if you're age 60 or above, we know that seniors, and especially those with other significant health issues, are particularly vulnerable to this virus. And so the recommendation from the CDC is if you're a senior, stay home. You know, Joe, my mom and dad, my dad is 81. You know my dad. My mom is 85. I've told both of them, stay home, don't go out. My mother's a 2-time cancer survivor. I've told her, listen, there's no reason for you to be out on the town. Just stay in your apartment. If you need food, order it online. But the best way for someone in a potentially vulnerable population to protect themselves is don't interact with people who might have the virus. For those who are not seniors, for everyone else, if you can telework, if you can work from home, you should. A whole lot of employers, AT&T, told its employees to telework and work from home. I think that's fantastic. I can tell you, my D.C. staff, I've sent all of them to telework from home. And during my time on self-quarantine, I've been teleworking. I've been working from home, and between the telephone and email and internet, you can get an awful lot accomplished without having to go and interact with lots of people and increase the chance of transmission of this disease.
It's important advice. It's Senator Ted Cruz, Republican, the great state of Texas, just about at the end of his self-quarantine. So before I get into the four steps that you want the administration, Congress, and business leaders to do, let me just ask you very basic questions that you know are happening around us. People are buying guns because they're hearing that people are breaking into people's homes to steal toilet paper and food. We're running out of toilet paper at Walmart and Sam's and everywhere else. I don't know why, because the coronavirus, as far as I understand, doesn't require you to use toilet paper, but they are. Water is running out of supply at these same stores. Usually you can call and get like a curbside pickup at an H-E-B in Texas or another big grocery store around the country, or you can get that at Walmart the same day. Now you've got to wait 5 days to go and get that. People are in a freak out mode, and I have not heard the evidence that tells me why we need to buy all the toilet paper or why we need to buy all the water. This is just a general human reaction. Oh crap, the media is telling me this is the worst thing we've ever faced on earth. We better go and buy the supplies we need, and I guess nobody wants to run out of toilet paper. Ted, I'm watching the president. president. I'm watching the CDC. I'm listening to you. And certainly it's serious. Certainly we should take the proper steps. But this seems above and beyond. And some people think martial law is coming, for God's sakes. So what can you tell me to either quell those fears or tell me the fears are correct?
Well, Pags, I think you're exactly right, that it is important for people to be calm and sober-minded and address this. This is a serious public health challenge. It is a global pandemic. We need to treat it seriously. That means we need to listen to the science. We need to listen to the doctors and the medical professionals. But what we shouldn't do is panic. We shouldn't give in to hysteria. And there's some voices, both in the political world and the media world, that are fanning the flames of panic. And I think that is a mistake. If we listen to the common sense advice about teleworking, about seniors staying home, about avoiding large social gatherings, the president just said this afternoon, gave the advice nationally to avoid gatherings of 10 or more people, to not go out. We've seen big gatherings in Texas and elsewhere canceled, things like South by Southwest and the Houston Livestock Show. And
those are huge. For those that don't know, they're huge.
They're huge. They're amazing. I'm glad my girls got to go to the rodeo this year before they canceled it, because we try to take them every year. But listen, I think those were common sense decisions. When you're dealing with a global pandemic, what you want to do is you want to bend the curve down. Normally, the number of cases spike exponentially, and the more social distancing you can do, the more you have people avoiding large interactions with lots of people, the more you slow down the spread of the virus, and that's how you beat a pandemic. We've got a whole lot of testing that is going out this week. There are going to be a lot more tests done in the next 2 weeks. We're going to see the numbers spike. We're going to see the numbers spike across the country. We're going to see the numbers spike in Texas as more people get tested.
Right.
And that, some of that is just how a pandemic spreads, but our behavior can impact that, can slow it down quite a bit, and can protect people's lives and safety.
Should people fear, Ted, martial law or a national quarantine or not?
I think martial law is a bit much, but I do think as this spreads, all of us can anticipate that this will affect your life. It probably has affected your life already. It's going to limit things. Look, when they canceled the NBA season in March Madness, for all of us who are diehard hoops fans, know I bleed Rockets red. That's what I do most nights is I DVR all the Rockets games, and late at night when I get home, I watch a Rockets game. That's what I do before I go to bed. Now they're playing classics, hardwood classics from prior years on ESPN, so I'm getting my fix there. This is going to impact everyone, and it may well, depending on the spread of it, it is possible we see areas that are put in forceful quarantines where you have to spend some time at home. I hope that doesn't happen. That's an extreme health step, and if we engage in these positive common sense steps now, we substantially reduce the risk of more dramatic steps. I'll tell you what I've urged the administration to focus on. It is 4 immediate steps, all directed to protecting health and safety.
Okay, good.
Number 1, making testing more accurate and more widely available. And I've laid out a number of specific steps for how to do that so that testing is available and it's accurate. Number 2, making sure that we have enough protective gear, both for first responders and for medical professionals, so that we stop the potential spread of the disease to those who are on the front lines of coming in contact with those who are ill.
Right.
Number 3, creating more capacity and providing critical resources for hospitals and other medical facilities, making sure we have things like ventilators and ICU beds. We've seen tragically in places like Italy where they've had a shortage of them and not enough equipment to deal with all of the very sick people they have. We need to be investing right now on an emergency basis to make sure we don't get in that situation.
Right.
And number 4, finding cures quickly. And I've introduced legislation to streamline the FDA process so that we can accelerate moving towards developing a coronavirus vaccine, moving towards developing treatments for those who are sick, and moving towards ultimately finding a cure for COVID-19, the disease that coronavirus produces.
It is Senator Ted Cruz, great state of Texas, about to end his quarantine, his self-quarantine. Healthy, no symptoms whatsoever after brief contact with somebody who had tested positive for coronavirus. Let me ask you this. When you say it'll spike, I believe you. I'm watching the seriousness of the president every day. I'm hearing the seriousness in your voice. I'm serious about it, although I'm sickened by what the left has been trying to pull on this. And in fact, it's somebody on MSNBC or something earlier today or last night said, more Republicans will die from COVID-19 because they're not taking it seriously. That's how stupid this is. But in reality, it's going to spike. I believe you. Ted, when will we know it's on the downturn? When will we know that we've turned the corner and we can start to breathe a little bit easier?
Well, Joe, this is not a Democratic virus. It's not a Republican virus.
Right.
It's a dangerous virus.
Right.
And it's a dangerous virus for everyone. In terms of the time frame of how long this will take to play out, we don't know for sure. I've asked that question. I've asked it multiple times of the CDC and health experts, and they don't know. We have seen in other places where in China, it appears the numbers have leveled out. Now, I say it appears with great caution because we have to understand the communist government in China lies. They lie a great deal, and in fact, they bear much of the responsibility for this spreading so widely and for so long because they suppressed the information. They didn't respond to it.
Right.
And so the fact that China says their numbers have stabilized, I'm not at all confident we can believe that. But we have seen with pandemics in the past, they run their course. It varies in terms of time. The guidance that the CDC has given is for the next 8 weeks, all of us should avoid social gatherings of 50 people or more. That's an 8-week time frame from the CDC. Just this afternoon, the president urged Americans to avoid gatherings of 10 people or more.
Right.
I think the point, but the medical experts don't know how long this will last. They do know that we can reduce the impact of it if we avoid congregating in large places where the virus can be transmitted.
Hey, Senator Ted Cruz, great steps and great suggestions that the government, that the administration, that Congress and business leaders, and we all should follow when it comes to the Wuhan coronavirus. And I call it that because that's where it's from. One last thing, and I don't want to make too much politics about this, but you know the show is out to 4.5 million people now, and the left listens to my show every day to see how they could pick apart what Ted Cruz and Joe Pags have to say. Ted, I would urge, and I want your comment on this, anybody who opposes us politically to just take a freaking step back and stop it. Because if we do work together as one, American community, I'm guessing we can probably take this thing on head on and do better than if we're divided, no?
Pags, you're exactly right, and anyone who's trying to exploit this health crisis for partisan advantage should stop. This should not be a partisan football. This should not be an avenue to attack the other side. I'll tell you this week, Alexandra Ocasio-Cortez tweeted out, urging, in particular, young people are packing into restaurants and bars in New York. She said, look, please stay home. Stop doing this. Even if you're at lessened risk of dying from this disease, you're at real risk of passing it on to others and threatening the lives of others. I retweeted her. I said, this is very good advice, and we should do that. Anytime you have AOC and me on the same page, that I think should illustrate this should not be an issue to play politics with.
Agreed, but unfortunately 2 days earlier she said we were a bunch of racists for not going to Chinese restaurants. So I'm glad that she turned the corner and that she's thinking clearly, and it's a good retweet. Hopefully, because somebody that far left and that far opposed to you and me and our thought process is on board, then maybe that'll turn the corner for those who follow her. And I guess that's the idea.
It is, and I hope. Now, look, I hope also. We're seeing some in Congress, Democrats in Congress, who support, for example, Medicare for all and socialized medicine, trying to follow Rahm Emanuel's old dictate of never let a good crisis go to waste.
Exactly.
And so you're trying to use this to push the policy provisions that they support. I don't think we should be doing that. I think if you notice the 4 things I laid out, they're all directly tied to combating this health crisis. They're not unrelated. Listen, I support ending the death tax. I think the death tax is a bad thing. Right. I'm not proposing we eliminate the death tax as part of a coronavirus response because it's not an element in how you combat a global pandemic. And so I think we need to stay focused on actually the problem in front of us and marshaling all the tools we have to stop it. And I will say, I didn't watch all of the Bernie Sanders-Joe Biden debate last night, but I did find it interesting. One of the most revealing exchanges is when Bernie was saying we need socialized medicine and Medicare for all. And he points to Italy and how bad things are going in Italy. And Joe Biden quite sensibly came back and said, Bernie, Italy has socialized medicine. Italy has what you're advising for the U.S., and it's not working there. Their medical system is overwhelmed. And I thought it was a powerful exchange. It was like one moment of common sense in primary season that hasn't had a whole lot of common sense.
I'm with you. Ted, incredible. Thank you for the extended interview today. I think people really wanted to hear directly from the source, a guy who made contact with coronavirus, and thank God you're okay. And just really calming tones coming from you. I think that's going to help exponentially. Thanks a million.
Thank you, my friend. God bless.